So good morning everyone, good morning, and I would request that you give us a thumbs up if you're able to hear us and see us. I'm Dr. Sumesh, with me I have Dr. Deepti in the daily Transform series on the DAMS app.
Yes, very good morning to all our dear students. Yes, how's everyone doing? Are you able to all see us and hear us well? Let us know.
Perfect. Okay, so yes, I can see most of you are there and most of you are able to hear us and see us. Today we will discuss something which is not talked about. So I'll ask you the question today, and we will answer the question from our own experience, and we want you also to answer side by side. What is the X factor? What is that X factor that helps you to crack a competitive exam? What did you see this year when you were, looking at the interviews of the high achievers? What is that single most important X factor?
Okay, I think some of you are going to say that they were just lucky. Yes? Do you think the most important X factor is luck?
Probably, that's important, but that is not in your hand. What is the controllable X factor? So I'll start with the first one. I'll start with the first one. Then I'll ask Roditi to add on. One thing that I've learned in the X Factor by talking to all the high achievers over the years is stamina, not physical, mental stamina. That, I have seen, and you would agree, many students, when they are concentrating at a stretch, they are not able to concentrate for 3.5 hours. You might say it is my consistency, my revision, whatever. But if you're not able to concentrate on the day for 3.5 hours, you will not be winning the game. To win the game, I need to be concentrating. But to do that, I need to do it before. So practice that long stretch hours. And I was taking an interview of this rank 3 this year, and she told me that, sir, when I started attending DAMS classes, she's from Mumbai, and she was attending DAMS Mumbai face-to-face class, DAMS Ahmedabad, face-to-face classes, and she came back and said, sir, during those classes, initially I felt that maybe I am sitting and concentrating for a long time. Is it good or not? But after giving the exam, she realized it was a good idea to concentrate for those hours. So I would always say, whenever I am taking a face-to-face class, you will see I would take a class of a length, and then I'll say, boss, इतना करना है क्योंकि एग्जाम में भी इतना करना है.
Absolutely, yes. And not just this, and this is why, when we did the marathon session for INICET, some of you have been, were asking how long would the session go. And, by the end of the day, I saw so many of you were studying live and you sent me a message saying, I did not know that I could study for this long, or I did not know that I can concentrate for this long, and I did not know that my focus was so strong and I can stretch, and that made a lot of difference.
And
Right?
also, when we look at people who are doing a recorded lecture, when you are doing a recorded lecture, it is in your hands. So when it is in your hand, after 15 minutes, you get tired, you pause, and you think that I will do better if I'm concentrating better, so I'll do it later on. You tend to procrastinate. So one of the X factors which is ignored by many people is the your ability to concentrate for 3 hours.
Yes, so absolutely, I would say that whenever you have to study, it is important that when you feel like you can't go any longer, it is important to switch up, right? For example, I always say study for 2.5 hours. Okay, study whatever anti-grade revise you can revise, and then when you feel tired, you do a switch over, do a 20 MCQ test, right? And that is the real purpose of why we're giving you different types of so many tests, so that you have a variety, as well as you're able to stretch your limits, and you're also swapped, right? हो सकता है कि आप medicine पढ़ रहे हो, but now you're doing the MCQs for gynecology, या आप PATH पढ़ रहे हो, but now you're doing MCQs for, let's say, pharmacology. So it also helps you to do the swap and test your real recall as well, which you have to do in the real exam, है ना?
अच्छा, दूसरा मैं बताता हूँ. दूसरा जो है ना, कि आज जब आप ग्रैंड टेस्ट दोगे, ट्राई टू डू इट एट योर टॉप कंसंट्रेशन लेवल थ्रू आउट. ऐसे करते हैं जैसे सपोज आप ट्रेडमिल पे भाग रहे हो, तो आपने किया कि मैं 1 किलोमीटर पर आवर पे भागूं, 2, 3, 4, 5 ऐसे बढ़ाते गए. ठीक है, ठीक है. लेकिन जो टॉप स्पीड है, जो एग्जाम में तो हर क्वेश्चन में टॉप स्पीड चाहिए ना, उस पे कितनी देर भागेगा वो गेम है यहाँ पे. So can you do top consideration your grand test will be a X factor. The second X factor that I wanted to introduce today is your peer group, your mentors, and this is sometimes ignored. ऐसा लगता है कि सबके दोस्त एक जैसे तो होते होंगे, सबके टीचर एक ही तो होते होंगे. It's not true. It is not true. It's very important. Now I was talking this another top achiever this time on the interviews, and this top achiever told me that sir, my rank came because my friends, all my friends were supportive, encouraging, and they were always telling me to study. They were, and each one of us, whenever we were getting negative, the other one would push. So your peer group and your mentor influence always matters.
Yes. What I would also say is a very important thing, and you have to learn that, and you still have many opportunities to achieve it. What I have seen is what helps in building the so-called X factor or a winner instinct is small victories. समझ रहे हो? Sometimes what happens is you feel that you don't have enough what is required to be in the top ranks or good ranks or to be a high achiever. Yes, but when you start accumulating small victories, you know, suddenly you grow in confidence and you are willing to take up more challenges. The fear is replaced with, you know, the possibility of I have higher chances of winning as compared to others. And this is exactly the second reason why I want you people to appear for a lot of smaller tests, right? The reason is every time you get 18 out of 20, you feel, oh God, yes, I'm almost there. You get 17, oh, I'm better than yesterday, right? So you have many opportunities, and it is very, very important to have those small victories because they build your confidence. They build your ability to take up challenges and to go with a mindset where you feel you have a higher probability of winning as compared to others. Okay?
And another thing that I wanted to add from my side is that you become a sum total, you become the average of five people that you hang out with. And that is why, you know, we started hanging out with you on YouTube because we wanted to hang out with young people. Because if we are hanging out with young people, we will become young.
Yes.
Similarly, if you're hanging out with us,
That's so
हम
true.
नेगेटिव नहीं होने देंगे.
हाँ.
हम नेगेटिव होने नहीं दे सकते क्योंकि हम हो ही नहीं सकते नेगेटिव. So
Absolutely.
you become average of five people that you hang out with. अगर आपके चारों दोस्त, आज आंख बंद करके सोचते हैं, अगर आपके चारों पांचों दोस्त जिनके साथ आप रोज टाइम बिता रहे हैं, वो रोज कह रहे हैं कि जिंदगी में कुछ नहीं करना, कुछ नहीं करना चाहते, तो आप भी नहीं कर पाओगे. इट इज इम्पोर्टेंट. तो फिर दोस्त बदलते हैं, बदले जा सकते हैं, बदले जा सकते हैं, कंपनी बदलनी पड़ेगी. एंड वी टेल दिस टू ऑलमोस्ट एवरीवन इंक्लूडिंग आवर चाइल्ड आल्सो कि बॉस लेट्स हैंग आउट विद पीपल हु वांट मोर आउट ऑफ लाइफ.
Yes, ये बहुत जरूरी बात है. You know, it is very essential that when you are hanging out with people जिनमें बहुत भूख है, you know, they want to do well, they want to achieve more. You know, it is this fire which is ignited even in you. I'm sure आप सबने सुना होगा कि अगर you know, एक बैटरी ऑफ कैंडल्स लगा है एंड आप एक को भी जलाओगे तो क्या होगा कि you know, the small candles can keep the further ones, you know, going strong.
Okay, and let us add one more line about your X factor. Now the X factor I'm going to talk about will require more discussion. Okay, the first one was that your mental stamina. Second one was people you hang out with. Third one is pattern recognition. Now, what do I mean by pattern recognition? All of us, we believe that MCQ exam is about knowledge. Do you think so? It is, definitely it is about knowledge, let's agree. But it is applying that knowledge on four choices. Imagine now, suppose your exam was fill in the blanks. Then the idea would change because there is nothing to choose, there is nothing to recognize. You need to know it and answer it and type it. But if it is a multiple choice question, there is the answer is written in front of you. Are you able to identify the pattern? This pattern recognition begins when you look at the PYQs, when you're doing a grand test, when you're giving the class test, whenever you are using those multi-level testing on the DAMS app, you are always trying to see the pattern. The toppers are looking at the pattern and predicting. When they look at a PYQ, they predict how it would look like. When they look at the exam question, they try to find the pattern.
Okay, don't worry. See, GT49 may have been a little on the tougher side, but there is a purpose for everything. Abhi CBT bhi aayega, abhi mock bhi aayega. See, we have to get you mentally prepared for everything. Okay? Har baar it is not going to be how you want it to be. है ना? You cannot control it. So we have to learn the art that even when we are solving MCQs, suppose some of them tend to be on a slightly higher difficulty, how to still maintain the calm, how to now use the MCQ skill to get better, right? इसलिए मैंने बोला था for all those people who haven't seen those two transform sessions that we did. One was where we were talking about guess it technique, and the other was where I have talked about silly mistakes. ये दोनों ट्रांसफॉर्म को मिला दोगे तो इसमें वो सारे स्किल्स हैं that you need to approach and manage MCQs with. So don't worry, हमें पता है कब आपका कॉन्फिडेंस बूस्ट भी करना है और हमें ये भी पता है कि कब आपको ग्राउंडेड भी रखना है. So relax, it is just a part and parcel of preparation. Okay, आपका माइंड सेट प्रिपरेशन का पार्ट एंड पार्सल है ये, and therefore take it in its stride and say it was tough for everyone, right? भाई आप मेरी बात समझो, INICET भी as such I won't say was unique in topics or very difficult topics, but फिर भी हम सबका number of correct drop down हुआ ना, so that's what it is, right? It is the pattern of the paper, so you have to take it in its stride and you have to understand that it would have dropped down for everyone, right? And then therefore we have to see कि अगर मुश्किल आ रहा होगा तो क्या मैं अपने MCQ skills use करके can I get a little better, okay?
So all we are here to tell you today is, and then I'll ask Dr. Deepti to ask you a few questions to to get you on the track. But all we are here to tell you today is, कि boss, it is not just about knowledge in the final day. It is also about your mental stamina. Try practicing concentrating for 3 hours. आसान नहीं है, आसान नहीं है. 3 घंटे तक कंसंट्रेट कर पाना आसान नहीं है. अगर आदत नहीं डालोगे, पेपर वाले दिन पे माइंड वेवर करेगा, सिली मिस्टेक होगी, 140 की जगह 130 करेक्ट हो जाएंगे. जो रैंक एक एक नंबर से एक एक क्वेश्चन से हिल जाती है वो खराब हो जाएगी. मेंटल स्टेमिना इज अंडररेटेड बट इट इज रिक्वायर्ड. अटेंड योर लेक्चर्स लाइव. whenever we are on the DAMS app taking a live class, you will see the teacher will say, आप बोलोगे सर ब्रेक, टीचर बोलेगा 5 मिनट और 5 मिनट और. याद है
अभी
मेरी
लेते
क्लास के
हैं,
अंदर
इस टॉपिक के बाद लेते हैं.
मेरी क्लास के अंदर I always tell you that 5 more minutes to make sure that we stretch our limits,
Yeah,
we stretch our limits of mental stamina. Okay. The second thing I want you to know is, which is very important that we talked about, was peer group, and this is again underrated. Nobody is talking about it. उसके बारे में कोई बात ही नहीं कर रहा. But if you hang out with people who want more out of life, if you hang out with people who want more out of life, you will become one of them. If you hang out with people who don't want anything out of life, if you hang out with negative people, don't want वाले तो ठीक है, एक हो गई नेगेटिव, दूसरों को गिराने वाले, जो लोगों का पैर खींच के नीचे लेके आ रहे हैं, then you know it becomes tricky. You become an average of 5 people that you hang out with. And the third one was pattern recognition.
Pattern recognition. Also, we did talk about small victories and getting better day by day and reaching there. Okay, so you know, just persist. इसीलिए हम आपको हमेशा chat box में we ask you to write something positive, because that's what we want to leave as an impact. That's what we all of you want you to read as well, है ना? Because we want to create a community who is trying to push each other, right? We're trying to communicate or have a group of people. Maybe it's a small community. We doctors are a small community. उसमें से भी हम एक niche बना रहे हैं. And we want to have here a support system, a group of people who are pushing each other, who are trying to tell that we have desires, we aspire to be better every day, right? So it is just a method of pushing you to your next level, okay?
And I'll take a few queries. I think we have a big day today. Dr. Deepti is going to take you our session today on the app.
Oh yeah, I do have PYQ ka Bhav session today, and with me there will be Dr. Anand as well, and together we are going to try and do our best. So do join us live at 5 p.m. for PYQ ka Bhav, NEET PG and FMGE 3.0, and let's do it to the best of our ability. Okay?
अच्छा, एक बच्चे ने पूछा है कि सर अगर मैं डांस का स्टूडेंट नहीं हूँ और मैं मैराथन अटेंड करूँ तो मेरा नुकसान होगा? बहुत फायदा होगा बेटा.
क्यों होगा भाई?
whatever we teach in our marathon or DVT is what is asked in the exam. So if you find it new, probably your resource didn't have it. जरूरी है ये बात जाननी कि जो मैं बताऊंगा वो एग्जाम में वही आएगा, क्योंकि हम 26 साल से पढ़ा रहे हैं. We only talk about the exam pattern. We are very concise. We don't
There will be
इधर उधर की बातें
nothing
नहीं
unique.
करते.
Don't worry. कुछ unique नहीं होगा, कुछ out of the world नहीं होगा.
हम
सिर्फ-
PhD नहीं कराएंगे आपको. ये बहुत सारे ऐसे लोग हैं जो
मगर फिर भी आप PhD के लायक होगे. That's the
मैं नाम नहीं
beauty.
बताऊंगा, लेकिन बहुत सारे ऐसे लोग हैं जो जिसको पता ही नहीं कि क्या करना है. वो बहुत सारी चीजें पूरा का पूरा चैप्टर के चैप्टर बताए जा रहे, उतना नहीं आ रहा पेपर के अंदर. पेपर के अंदर जो चीजें आती हैं MBBS लेवल पे वही आती हैं. NMC के द्वारा बनाया गया एक सिलेबस है, उसी को फॉलो किया जाता है. And if you want to look at that, you can actually download the CBME curriculum from the NMC website, which we need to know. And this is what we try our best to do. We try to manage as per the recommendations. So that's why we have the best strike rate in the country for so many years now. And also, I'll now ask Dr. Deepti. Dr. Deepti.
Yeah. What do you want me to do?
पहला क्वेश्चन.
OMG. अभी तो आज तो मुझे क्वेश्चन करने हैं. Why don't you start today, Dr. Sumit?
Okay. So my first question for all of you is, let us see if you can answer this. It is going to be a tricky question. Let's see if you can answer. Let's see. Or maybe you can start.
Okay. Let me ask you. Let's try and do it this way. Okay. Quickly tell me what would be the key word to differentiate placental abruption from uterine rupture. Can you tell me what would be the important word to look out for when we talk about uterine rupture and placental abruption? सोच के बताओ, what would be the key word? Okay, all right, very, very nice. So we have some key things coming up and I like it. Absolutely, yes. So if there is loss of station, that is very characteristic to uterine rupture. Very well said. Good job done, people. You're giving me the next keyword also. Excellent. The next important thing is fetal parts. If it is rupture, fetal parts are very easily or superficially felt, while if it is abruption, they are difficult to feel. Good. And the third one will be what? No, not non-reassuring fetal heart. वो तो दोनों में मिलेगा. The third one is uterine contour. Yes. If it is abruption, the contour is very tense and it is very well made out. Whereas if it is rupture, the contour is lost. Okay. So look out for those three keywords.
Okay. And as I promised, I'll come up with a tougher question. My tough question for you is, there is something called as variant Creutzfeldt-Jakob disease, CJD. Variant CJD. Okay. And I want you to answer, what do you expect to see on MRI in a patient with variant CJD or bovine spongiform encephalopathy? What do you expect to see on MRI, which is prion disease, Creutzfeldt-Jakob disease? What do you expect to see in the variant? In CJD, you would see cortical ribbing. That is correct. I see many of you saying cortical ribbing, but I want to know about variant CJD. Okay, so cortical ribbing is seen in sporadic Creutzfeldt-Jakob disease. That is correct. But what about variant? This is not the answer. I am looking for the sign that is seen in variant CJD. And now I can see some of you are answering correctly. I think one bacha is saying hockey stick sign. Yes, perfect. So the pulvinar, the posterior part of the thalamus, which is called as the pulvinar, is involved. And you see a bright signal in the pulvinar, which is called as the hockey stick sign. Very good, beta. The hockey stick sign or the pulvinar sign. This is the kind of new question sometimes which is nowadays being asked as a one-line. Okay, Rodhi.
Okay. Let me ask you this. Okay. A 55-year-old woman with family history of breast and ovarian cancers is BRCA1 positive. Okay. So 55-year-old woman with a family history of breast and ovarian cancers is BRCA1 positive. Today she is diagnosed with a right ovarian mass. What would be the likely histology? Okay, tell me. What would be the likely histology? Let's see. So 55-year-old woman with a family history which is significant has BRCA1 mutation positive. Today, if she is diagnosed, let's say, with a ovarian mass, what would be the likely histology? So I'm still waiting for the answers. Okay, somebody's saying clear cell, somebody's saying serous. I'm waiting for the others. Okay, so Anshita, Adit, and Ruchita. Okay, somebody's saying granulosa, somebody's saying clear cell. Yes. So is it mucinous? No. The answer remains as serous cyst adenocarcinoma. Okay, it remains as serous cyst adenocarcinoma. So when BRCA1 mutation positive develop ovarian cancer, it is usually serous cyst adenocarcinoma. But are you ready for a googly on this? And that will be my last one. But if you get a one-liner, see what I did was a clinical question, okay, with some keywords. I want you to show how identification of keywords changes these scenarios, okay? So were you all able to get the first question, which was clinical, right? But now I'm going to give you a one-liner as well, and you will see what I'm trying to highlight. Which is the most common mutation seen in serous cyst adenocarcinoma of the ovary? Okay. The next one is a one-liner. Which is the most common mutation seen in serous cyst adenocarcinoma of the ovary? Let's see what you will answer. So, the striking important thing here is the answer BRCA1 now? No. Okay, the answer is not BRCA1. Now the answer becomes what? P53. So do you understand how the keywords, in one question I asked you overall most common mutation in ovarian cancers. The answer is P53. In the other question I said if a BRCA1 positive mutation develops ovarian cancer, what is the likely histology? It remains as the most common one still, which is serous. So do you now understand how important it is to know your content but also be able to use keywords and then find out which is the better answer? Because options तो दोनों question में same ही होंगे, right? But it is for us to reach to the right answer. Okay?
Okay.
Perfect.
And final question from my side, because we promised to tease you a little bit today, so we are doing it now. And my question will give you an insight on the pattern of the central institutes. Okay, I want you to reactively answer to my question and tell me. My question is going to be a true false question. Okay, are you ready to type? Are you ready to type true and false? Okay. Extradural hemorrhage in brain, EDH in brain, is always arterial. True or false? EDH, extradural hemorrhage in brain, is always arterial. True or false? Let's see if you can answer. So many of you are saying true, some of you are saying false. Let's see.
I'll also say something. I think it's false.
I don't know.
Okay, I'm also putting my voting. I go with false.
Extradural hemorrhage is always arterial. True or
now
false?
you're using voice modulation as well to give them the hint.
Okay. Now, second question, beta. Second question. Now tell me, what most commonly extradural hemorrhage is due to rupture of? Most commonly, EDH is due to rupture of. Anyone? It is due to rupture of middle meningeal artery. But my question was, is it always arterial? That is a false statement because it was a superlative statement. And we gave you that hint in the guess it also.
Yes.
The extremes are not the answer.
We are trying to tell you how to use the guess it transform
It is possible to have a EDH, which is a venous EDH in the anterior temporal area due to rupture of the venous sinuses. But sometimes you may not know. And you might think कि exam चल रहा है, एक choice लिखी है, EDH is always arterial, and you're like, हाँ sir ने बताया था ये middle meningeal artery से होता है, but that is the most common thing that we talked about. यहाँ always लिखा है, तूने ध्यान नहीं दिया, तेरा एक नंबर कम हो गया, and then you come back and say कि sir मेरा ठीक क्यों नहीं हुआ?
नहीं, या तो silly mistake थी, है ना?
है ना? So keep in mind, we need to keep in mind the ability to critically see what is being asked in the exam. That is the X factor. Translate into your language. आपको लगेगा हाँ यार ये ठीक नहीं कह रहा, मैं अब हिंदी में बोल के बताता हूँ. एक्स्ट्रा ड्यूरल हेमरेज हमेशा हमेशा आर्टीरियल होता है। लग नहीं रहा यार, लग नहीं रहा, हमेशा थोड़ी कोई चीज होती है, हमेशा तो कुछ होता ही नहीं है। You understand this or not? So translate into your mother tongue to get that X factor.
So, I hope we all enjoyed the session today. We always do. Whenever we are, associated with all of you, it's always fun. And I always say we learn so much from our students. There is no end from how much I can learn from all of you. And it's always a pleasure. So, go back, start studying, convert your day into productive day. Take one day at a time and make the best out of it. Okay? Chalo jao. Okay?
And we wish you all the best. Keep rocking. Have a productive day ahead. And tomorrow we'll look forward to meeting you again at 10 a.m.
And also remember, I have my PYQ kebab session.
Soon I am going to come up with some very interesting feature on the app. So, I am hoping to do that in the next 2 days. So, very interesting thing I am bringing you for you up on the app. मुझे ऐसा लगता है कि डैम्स के ऐप के ऊपर now we are living in the next generation of e-learning. Daily live classes, AI powered features, AI powered tests. मुझे ऐसा लगता है कि I'm so happy to be alive in this new generation of artificial intelligence, and I'm so happy to be able to apply everything on the app for you. मेरे को हमेशा ये लगता है कि I always tell Dr. Deepti also कि you need that luck factor to be able to do whatever you want to do. तो मेरा जो सपना है मैं सब कर पा रहा हूँ। मेरा सपना है कि मैं आपको बेस्ट दे पाऊँ, इंडिया का पहला लाइव लेक्चर प्लेटफॉर्म, इंडिया का ओनली लाइव लेक्चर प्लेटफॉर्म, इंडिया का पहला AI पावर्ड प्लेटफॉर्म जो आपकी रैंक्स को बदल देगा। सो मेरे पास एक बहुत बड़ा फीचर है, लेके आऊंगा 2-1 दिन के अंदर अंदर, याद रखना।
Take care everyone. Bye bye. See you soon.